So I'm a father of two. And I feel like when my wife was pregnant, every single time she said my head hurts or my feet hurt or my body hurts, like I had the same feelings. And I'm like, honey, let me get a little bit of that sympathy. Let me get one of those awesome foot massages. And sometimes she would. But it turns out that those feelings, as well as the restlessness and the heartburn, like all of these things kind of went away after she had our children. And it turns out that I was probably suffering from what they call Coivade syndrome, or what us laymen's like to say, pregnancy sympathy pains. And though I had the somatic symptoms, I didn't really have a disorder that went along with it. But there is something called pseudocyosis, and this is where a woman actually has medical symptoms of being pregnant, like she actually might have a swollen breast or may not even have a period for a significant amount of time while she's going through this. She might have morning sickness, and in some cases might actually have labor pains or might actually feel fetal movement. And all this happens with no physical medical reason. And it falls into what we call in psychiatry, in counseling, as somatic syndromes, somatic symptoms. And in some cases, it's even called somatic symptom disorders. And the American Psychiatric Association says that a somatic symptom disorder is diagnosed when a person has a significant focus on physical symptoms such as pain, weakness, or shortness of breath, or in this case, that the woman actually felt like she was pregnant. And in this, it causes major distress and even problems functioning. You can imagine what it would be like feeling like you are pregnant and going to the doctor and there being no medical reason for you to feel this way. I mean, look, you've got even signs and of what's going on, and yet you get an ultrasound and nothing. And it's just crazy what our minds can do. But it's not something that someone typically is going out saying, like, I want to feel this way. It's not. But there's a point where the American Psychiatric Association states that these people are actually uncertain of what to believe. Like, they can't even trust themselves to say, is this something that's really happening that's caused by a major medical illness, or is this something that is just a routine thing that's happening day in and day out? And it can be hard for providers and loved ones too, because how do you diagnose or how do you look further into what a person's feeling if they can't even trust themselves to understand? And this can cause providers, medical providers, to just brush off someone. Or if we actually look at this study that was done in Germany, it found that people that were suffering from SSD, like there was a stigma attached to them that actually led to higher suicide rates. And it's just crazy to think about what's going on. It's crazy to think about what goes on in someone's mind. But as you're looking at these different syndromes, like somatic syndromes, there's some that actually blow my mind even more, because even when you look at conversion disorders, there's a part of that under mass hysteria that's really, really interesting. And let's take this case that happened in 1518 and what's called the dancing plague. And it started with one woman who went out into the middle of the street and just started dancing uncontrollably. And she danced and she danced and she danced until finally she just fell over in exhaustion. And when she rested, she started dancing some more. And before you know it, by the end of the week, there were 30 to 40 people dancing with her. And after 2 months, when this thing finally stopped abruptly, hundreds of people had been involved with this uncontrollable dancing in the streets, to a point where multiple people died. And it's just crazy to think about what's going on. And then there's this other case. This other thing that is called factitious disorder. And when I read about this, my mind specifically went to a case by a study by a disorder or a recurrent episode that was highlighted in a podcast called Scamanda, and it was about this lady named Amanda Riley. She actually defrauded over $100,000 from people, from donors, because what happened was she started off by saying, I have breast cancer, and yet she never did. And then finally, over that time, she got to a point where she said, I'm in remission. And then years and years later, for no apparent reason, no medical reason whatsoever, she came back and said, I have breast cancer again. If you haven't listened to the podcast called Scamanda, I highly recommend it. But outside that, we look at what's going on with somatic disorders, and there truly is a mental reason for people to get behind it. And we can't just think that these somatic symptoms are just going to go away. Hybelius et al. 2022 suggests utilizing exposure treatment. He actually found in a study that avoidance behaviors can actually exacerbate somatic symptoms and add to the longevity of the disorder in itself. So in exposure treatment, it means that we meet the symptom head on, or the fear head on. See, therapy is an important and vital piece to actually understanding and helping the patient understand what they can trust and what they can't trust in regards to their somatic disorder. And all of this comes into play with the help of therapy, and sometimes if other medications are needed, but it really does take communication and patience and loved ones and a support system. So if you're suffering from what we would call somatic symptom disorder, or if you're suffering from something that you can't quite put your finger on, and every single time you've gone to a medical doctor that someone just pops out and says, there's nothing wrong with you. Well, there may not be something physically wrong, but it doesn't mean that there isn't something wrong. Because what you feel is true to you, and they don't feel it. They don't have to feel it for it to be real to you. So please, if you're suffering from something, seek mental health and help with it. We always want to be able to help you through this, because what is real to you is real. And don't let anyone else tell you that it's not.